Gastroesophageal reflux is called reflux for short. It is extremely common in all healthy infants where contents from the stomach backwash into the esophagus 30 or more times every day. Some of it will be vomited or spat out, but most slides back down into the stomach. The frequency of reflux declines as baby gets older and generally decreases towards the end of the first year of life and is unusual in children older than 18 months. In the majority of infants, a focused history and physical examination will confirm that the reflux is uncomplicated and little further evaluation or intervention is usually required. Simple measures will usually help control the symptoms, like positioning your baby upright after feeds for about 10 to 20 minutes as they get their wind up, elevating the head of the mattress in the bassinet or cot with a small rolled up towel underneath the mattress, or thickening the feeds with a thickener. Warning signals that may suggest symptoms of obstruction or disease in a refluxing infant include the following: the presence of green bile in the vomit, gastrointestinal bleeding, which is characterised by blood in the vomit or blood in the stools, consistently forceful vomiting after every feed, onset of vomiting after 6 months of life, abdominal tenderness, abdominal distension, recurrent pneumonias or chest infections, constipation, and diarrhea. Infants who have reflux and are not gaining the appropriate amount of weight for their age need to be seen by their GP or referred to a paediatrician for review. Reflux and poor weight gain also may be caused by food protein-induced gastrointestinal disease, and this is often referred to as cow's milk protein intolerance, because cow's milk protein is the most common trigger. All formula milk or non-breast milk is made up of cow's milk and will contain the cow's milk protein, whey and casein. Breastfeeding children can also develop cow's milk protein intolerance. For mothers who are breastfeeding, if they have a high dairy intake in their daily diet, some of the cow's milk protein will pass directly into their milk and subsequently into their child when feeding them. Symptoms may include the following: taking longer to feed, pulling off the breast or pulling off the bottle after soon starting a feed, crying associated with feeds, difficulty to burp and wind after feeding, lifting their legs a lot and passing a lot of wind, or being unsettled while they sleep. For most formula-fed infants with reflux and poor weight gain, which is thought to be due to cow's milk protein intolerance, we suggest a 2-week trial of an extensively hydrolyzed formula. For breastfeeding babies, we would advise the mums to remove all sources of beef and dairy from their diet and to replace with an equivalent substitute, ensuring they are getting sufficient amounts of calcium and vitamin D in their daily intake. Products that contain cow's milk protein or dairy products include such items like milk, cheese, yogurts, chocolate, ice cream and cream. The response to this change is often more delayed than in formula-fed infants because it takes some time to eliminate the offending protein from breast milk, and small amounts of milk or beef protein may be found in foods. If there is not a clear response to the diet change during the trial, other diagnoses and treatments should be explored. If you are concerned, please see your GP or paediatrician.